Good evening from New York. I am Selwyn Collins, your host of CWS Journeys. Welcome to another edition. The lovely lady next to me is Dr. DeCosta. She's a native of Guyana, South America, raised in Brooklyn. Dr. DeCosta is an assistant clinical professor at the Mount Sinai School of Medicine. She's a graduate of CUNY, Medgar Evers College, Columbia University, and SUNY Buffalo School of Medicine. She is board certified in physical medicine and rehabilitation and enhanced her education by studying acupuncture, which included clinical training in Chengdu, China. Do I have that correct?
That's correct,
Chengdu. All right. Let's just get started.
Okay.
All right. Welcome.
Thank you. It's a pleasure to be here.
Thanks. It's a pleasure to have you, actually. I want to start by asking you, what is accurate about the way people close to you describe you? What do you agree with?
What is accurate? A go-getter, someone who is always smiling, someone who is loyal and helpful.
Loyal. I like that. If you were not doing this, what you're doing, if you were not doing this particular profession, or if you were not a physician, what other career would you like to have tried?
Well, this is my second career.
Okay.
I was a social worker for a few years prior to going into medical school. So it would definitely have to be a helping profession. And one of my secret professions would be acting.
Really?
Yes.
Have you ever done any kind of acting?
I did a little acting. My debut was in my high school class when I actually played Sidney Poitier in The Raisin in the Sun. It was a lot of fun. And recently at my church, we had an original movie called Love Me Through It about the reaction of the community to someone with HIV and AIDS. And I played an extra. A very prominent extra. So I enjoyed doing that.
You talk about high school. You were born in Guyana, right?
Yes.
Give us a glimpse of your life growing up at age 9 and 15.
Okay. By age 9, I was on my way back to the United States from Guyana. I had already left around age 7 when I lived in Toronto for a bit, and then New York, and I came back to Brooklyn at age 9. So while I was in Guyana, I was actually going to St. Stephen's School, and I enjoyed it. My teacher, Joy Burkett, was very supportive and just made me feel so bright. And I remember running around in the fields. I think it was once a week we could wear our blue shorts and a white shirt, and we get to go out and play and run and have fun. That's what I remember.
So you mentioned Canada. What age did you go to Canada?
Age 7. I went to Canada to join my aunt and my mom. I went along with my 2 cousins.
Mm-hmm. So was it a culture shock for you? Do you remember that at that age?
Oh yes, it was in April and it was in Toronto. It was snowy. I remember my cousin and I got lost just going around the corner because there was so much snow and we didn't really know the place, and we were bundled up, and just it was a bit of a culture shock. Yes.
You mentioned your mom and your aunt. How are these women? How have they helped to shape the woman you have become today?
Well, they were both orphaned when they were young, and they fought through all adversities to really become very accomplished women. My mom, God rest her soul, she passed away, going to be 5 years. She was the first Assistant General Secretary of the Guyana Labor Union. So I grew up when I was in Guyana listening to her on the radio talking about how to help people to get the right kind of foods that they needed, etc. She was really someone who was before her time. As she was described by someone who followed her at the labor union. My aunt also went up to Canada, worked hard. They both owned their own homes. Just really independent women who like to work hard. And my mom also I would say she was almost like the Harriet Tubman of New York. There's so many people I remember coming to New York and staying with us until they could get on their feet. And many of those people were able to buy their own homes, etc. So just a lovely example of how to live and how to give and how to be a responsible human being and to just love other people and to smile a lot. I thought it came from me, but it really came from her. When she passed, I realized that she liked to talk, I like to talk, and she always had a smile and a very kind word to say. So I kind of try to model after her.
Any words of wisdom from your parents that you can remember?
Well, a few things. The one that just popped into my mind is that my mom always said, never a borrower or a lender be. So she didn't believe in owing people too much and borrowing too much. So sometimes in business you have to do that, and I just remember that. And she also said, if you're going to lend someone money, then you make sure that you don't really need it back.
Apart from these two women, and we'll talk a little bit, you and your own business, we'll talk a little bit about that later. But I'm just curious, apart from these two women that have helped in some way to shape you as a woman, who are some other women you remember while growing up that you admire and respect?
Well, a lot of people, my cousin Burgett, who is in Guyana, my cousin Brenda, who was also older, my sister, very much I followed her in terms of love for education, after she followed my mom in that way. My professors, I remember Dr. Ed Mead, who was very no nonsense at Medgar College, and Dr. Ferdinand, who was very encouraging, very open and honest. A lot of people. I look at so many women that have gone, before us, Maya Angelou, Oprah Winfrey, all of these people, it's like now I'm older, but these are people who have made an impact in my life.
If you were to eavesdrop your parents, or let's say your two aunts, telling a stranger about you, how do you think they would describe you?
That Carol, she always wants to do more. She's never satisfied. She's always wanted to go to the next step.
Is that true?
That's true. That's true.
You started Remas, your business.
Yes.
1998.
That's correct.
Of course, congratulations for the longevity.
Thank you.
What was going through your mind when you were thinking about starting this business? What was the trigger to start your own?
The trigger was I actually was working for someone else and working very hard. I learned a lot from him, and I felt that if I would be working hard, staying late hours, I'd like to do that for myself. And I was also the sports medicine doctor at Medgar College, and they encouraged me to try to do a little bit more with them. And I was on Staten Island working, and I decided I like being my own boss. So I wanted to step out and do it on my own.
So what are some early challenges you had, and how did you overcome them? Well, just tell us about the challenges.
Yeah, when I started out, I actually started out with a partner who was a good friend of mine. We both went to Medgar College. He went directly into medical school when I went to Columbia for social work. And he was in the same specialty, so we spoke and decided we would open up the practice together, and which we did. It was kind of fun doing it. I had a lot of time. I get to play tennis and so forth because we didn't have many patients. And I would be able to sit around, do a lot of reading, wait for the patients to come, etc. We had two different ways of practicing, and we ended up not being able to continue practicing together. So that was a big challenge, because we had a contract that we signed, and we didn't really have an exit clause, and we didn't really know to have that. So it was a little challenge. He went on to have his practice in a different part of Brooklyn, and I stayed at Remas. And,
Here you are, young,
yes.
Black, female, New York, private practice. I'm sure those attributes bring their own challenges with them. Do you think some of the challenges that you have, if you were not in those particular category, they might have been different or non-existent?
I think it may have been a bit easier. Just going through the channels of medical school, residency. I had a pretty decent residency program, but I think that I don't really focus that much on those attributes. I just try to do what I need to do. One of the things I know is that being of African descent, being a woman, being in medicine, being a professional in general, I always feel like I have to do the best that I can do. Always feel like I have to cross all my T's, dot all the I's, because I feel as though if I make a mistake, it's probably going to be magnified more than if someone who is not of color is being viewed or being looked upon. So I just try to do the best that I can, and always try to look at how I could explain what I did. Will I be able to explain to someone saying this is why I did it? So I try to stick to my principles, and I get a little annoyed when people ask me to do things that I think that it's not correct, or that may be outside of my ethical standpoint. I get upset a little bit, and just kind of stay focused and stay doing the best that I can do.
What is most rewarding, would you say, about owning your own business?
The most rewarding thing is that I get to set the standards. I get to make most decisions, and just my practice. I have wonderful patients. I love being able to have a place that aesthetically is pleasing, because I love to be around a nice environment, and I try to build a practice in a place that I would like to go to. So it makes me feel good when I could set a tone of having patients come in and being relaxed and trying to decrease their stress, trying to be that antidote to the stress of the outside streets of New York City, and being able to take my vacation for the most part when I want to. Not that I get to do it as much now that I'm working for myself, but it's good to be the boss.
Most will agree that running your own business is not easy. Lots of challenges, but especially discipline. Requires discipline to run a successful practice. Okay, here's a mother that is a go-getter, very, I have to say, very assertive, and from what you've said, assertive and disciplined person. So I want to ask you this question. Do you think, well, I imagine you are very disciplined.
Yes, for the most part, yes.
For the most part. Would you say that what keeps you going and keeps you in check, would it be the demands of the patients or your own set of principles? What's the driving force?
I think there's a combination of both. I really do. My principles are what I stand on, and depending on what the patient's needs are, I try to address them. So
for those days when you don't feel like getting up and doing what you need to do, you're just tired, like, oh my gosh. I mean, we all have these days sometimes. Who or what gets you out of that mindset?
Just knowing that people are depending on me, and I don't feel like I would want to disappoint. So I just get up and I do it. And talking about the mother that's a go-getter, I'm a mother that's a go-getter too. So when you're a mother, a lot of times you have to do things that you that are very difficult to do, but you know that that's your responsibility. So although I'm not a mother to my patients, I still know that they're depending on me, so I'm going to be there. I'm going to roll out of the bed and go do it and get my reward from helping people.
What do you think most people are surprised to learn about you when they get to know you?
That I'm really just a down-to-earth person. I love to dance. I love to laugh. I'm just down to earth. And I think that I have to tell you one of my favorite quotes from a patient. This is at Elmhurst Hospital where I go once a month. And I take care of patients in the rehab clinic. And this young man, about 18 or so, Hispanic, and he said to me, "Doctor, you mad cool." And to me, that's like one of the best things because here I'm totally different from him, and he could just see that I'm there with him, whatever person you are, wherever you're from, age, nationality, I'm going to be there with you, and I'm going to try to see you. And I think that that's what he was trying to say to me, that he realized that I could see him and I could see what his needs are and that we could work together.
So you were a social worker first?
Yes.
And then medicine. What inspired you to go into that?
Yeah, well, after I left Columbia and went into work as a social worker, I was at Kings County Hospital in psychiatry. So I worked in psychiatry for a couple of years on a women's unit. And I remember having a women's group, and the women would ask me, "Oh, doctor, why does X medicine make me gain weight, or why does another medicine have this side effect?" And I would say to them, "Oh, you have to ask your doctor. You have to ask your doctor." And I started thinking maybe I could. And the thing that really pushed me, I must say, that there was a doctor who was there on the same unit, and I felt as though he was culturally insensitive, and I thought I was still relatively young, and I could go ahead and go to medical school, and I could do better for these patients, be more sensitive culturally, and they may need to see someone like me.
So would you say that sensitivity, that compassion, drive a lot of drive the way you practice medicine?
Yes.
Wow.
I would absolutely say so. I think as a physician, compassion is something that's a necessary attribute, and that's something that I try to live out, every day. There's some bad days and there's some tough times and tough diagnoses and so forth to treat, but the compassion, I think, helps the patient, and it also helps me to be able to really get to understand what the problems are and how best I can help solve it.
Why that discipline, though? Why physical medicine and rehabilitation?
Yeah, physical medicine and rehab. I looked at other things. Of course, I was in psychiatry, and I thought I was going to become a psychiatrist. When I got into medical school, I loved everything. I loved OBGYN. I loved being in the OR when it was a happy time, babies are being born. I just enjoy. I didn't really like surgery itself, and I actually read a book, and it said how to choose a medical specialty. And that really helped me, because when I read about physical medicine and rehab, I actually looked at the whole person, the psychological, the physical, everything together. And it will also allow me to do sports medicine, and I enjoy sports. I enjoy supporting people who are athletic to help them to feel better. So it just was a natural for me, and I'm never looking back. I love this specialty. I love what I do.
I was going to ask you if there was any time at all when you thought maybe I should have tried a different discipline, a different area of medicine.
No.
So I always get challenged with this pronunciation. I was thinking psychology,
Physiatry.
physiatry. That's it. Physiatry.
Yes.
What does a physiatrist actually do?
A physiatrist is a specialist who goes to medical school and then does 4 years after medical school. That's 1 year of internship, 3 years of residency. And what we do is we evaluate, diagnose, and treat patients with any type of muscle, nerve, or joint injuries, and we try to get them back to their optimal level of functioning. Some of the things that we do intra-articular injections, that's into the shoulders or the knee joints. We also do trigger point injections into the muscles. We help people by writing prescriptions for physical therapy and also prescriptions for medication. In my case, I've added acupuncture, and there are a couple of physiatrists who also do acupuncture. So we are also known as the non-surgical orthopedists. We try to help people to avoid surgery, and if it's necessary, we try to prepare them for the surgery, which is called prehab, and we help them with the rehabilitation after the surgery.
So what is the difference between physical therapy and physiatry?
Okay, physical therapy is a discipline where the person does not go to medical school. They go to physical therapy school, and they specifically work on trying to help patients again and a team to get them back to their level of functioning. Some physical therapists work independently, and some work only under the prescription of a physician. So a physiatrist, again, is a physician first. We have a responsibility of making sure that any medication that we prescribe, anything that we diagnose, that we understand all of the anatomy and physiology and all the things that we had to learn to go through in medical school, and then to write a prescription that the physical therapist will then carry through along with their own independence, and they utilize our guidance in order to do the treatment for the patient.
You were in medical school. You're fascinated with some of the different areas of medicine, OBGYN and so on. I'm sure you must have come across people who have given you advice here and there. What is one of the worst, A, academic, and B, career advice anyone has ever given you?
I could think of one advice when I was thinking about transitioning from social work to go into medical school. And I went to speak with someone who was a pre-med advisor, and I was told that I should forget about going to medical school because it would take too long. I would have to do biology and then a year of chemistry and then organic and physics, and why don't you just go get a DSW? You already have a master's in social work. That was the worst advice. But I have to say, I went back and I saw another pre-med advisor, and I was told the same thing, the same information, but in a totally different way. It's like, oh, all you have to do is just do a year of bio and chemistry and organic and physics, and that's it. You can do that. So I just realized that it depends on who the individual is. They could be giving you the same information, but in a different way. And one could be very positive and help you to attain your goal, and another one could be very negative and try to dissuade you from your goals.
You yourself, you're an assistant clinical professor at the Mount Sinai School of Medicine.
Yes.
I'm sure advising young people or students fall under your purview of a teacher and so on. How do you make sure that a young student doesn't fall into this, or what you fell into, with an advice who you can't do it, or maybe you should do something else?
Well, sometimes I share with them my experiences, and I let them know that if they have a goal, that they should not let anyone dissuade them from it. And if someone says no, you just speak to the hand and keep it moving. Just tell them, speak to the hand, and not to let people dissuade you from your goal and what you know that you're capable of doing.
What does teaching do for you?
Teaching is something that is just a part of me. It makes me feel good to be able to share knowledge. I like to teach my students. I like to teach residents. I like to teach my patients. I enjoy teaching. As a mom, I kept teaching and teaching and teaching to the point where my son said, yes, I already know that. Now he's teaching me all those things. But I just love sharing knowledge. And again, it's part of one of my gifts, which is to help people. And and that's what I like to do. I like to help. And teaching is really helping.
1998, it keeps coming back to me. You started your own business and so on. 2016, many years later. When you look back on those years, what do you wish you knew then that you know now?
Oh boy. What I wish I knew. I wish I knew how to really look into big purchases, to make sure I do a lot of research. I had a couple of expensive lessons that I learned. Also, probably I would have bought a place earlier as opposed to renting. I think the lessons. I think I kind of I got really great advice from a smart woman who's in business, who's a banker, and who said to me, before you go into your own business, make sure you have enough money to live on for a year. And that was the best piece of advice. And so that's something I wish a lot of people would know, that when you start out in your practice or any kind of business, you probably will not reap any profits right away. So if you expect the practice or the business to really help you to pay your rent or your mortgage or whatever it is, you may get a little bit discouraged and give up too soon. So I think that
those early days when you weren't in the black, when you weren't reaping the benefits, what kept you going? What was the motivating factor?
I just loved having my own practice. I just loved having the opportunity to help people. So that just kept me going. Each patient that I met, I knew everybody by name. It took after a while now I don't know everyone, but I used to know all the patients, and it just kept me going because they were coming to me for help, and I was able to help them. And as long as I could continue to help people, and I was doing a good job of helping, then that just kept me going. It kept me motivated, and I just felt that I was there to have a service for the community, have a service for the referring doctors who are sending their patients to me, and also to be able to make my own decisions and set my own standards.
Any potential downside to PM&R that students should know?
Downside. Okay. There must be a downside. Okay, it depends. Okay, it depends. I think that if you really want to be able to focus in on only one thing, then it may be difficult for you, because in PM&R you're working with people who could be from infancy. Someone could need your help all the way into their hundreds. So there's so many different things that you have to know, so that you're not focusing in on one particular thing. I do mostly outpatient rehabilitation, more sports and musculoskeletal medicine. There's some people who are general, so they're taking care of people with a whole host of things like traumatic brain injuries, with spinal cord injuries, things like that. So it depends. If you want a specialty that's going to be like singularly focused, it could be a little frustrating, because you never know who is going to come through the door, and you might have someone that comes in with a stroke, or someone who has a neuromuscular disorder and things like that. Also you're working in a team, So if you like to be totally alone, then it may be difficult for you, because in rehabilitation medicine, we work in teams, and especially in a hospital setting, you're working with social workers, occupational therapists, physical therapists, psychologists. So if you don't really want to collaborate, then that could be a downside, for you as well.
Currently, what procedures or treatments do you perform the most?
I do electrodiagnostic testing, which is determining whether someone has a pinched nerve. We stimulate the nerves and look on a computer to see how the nerves are formed. We also use a small needle to check the muscles to see if the muscles are getting the right supply from the nerves. So this helps us to be able to diagnose things such as carpal tunnel syndrome. If there's what's called peripheral neuropathy that diabetics get when their sugar is not under control, and that causes the nerves not to run properly. So that's one of the major things that I do. Also, I do injections using hyaluronic acid, which is the base product of cartilage, and it helps people to avoid surgery who have arthritis in the knees. I also do trigger point injections, which is something that physiatrists do a lot. And if someone has muscle spasms in different parts of their body, like their necks, the shoulder, back, those are the most common, we use the needle to break up the muscle spasms and get more blood flow going into the area. So acupuncture is something that I love to do, and one of the differential advantages that we have in my practice is that patients can get Eastern as well as Western treatment. So acupuncture is something that I do on a daily basis, and it's very nice. It's a nice feeling having the patients relax. When they come into the acupuncture room, there's beautiful music in the background. They're having about 20 needles in them, but yet still they're very relaxed. And the lights are off. I come back in and they're sleeping or feeling much better after, say, having a headache or having any type of problem. So the acupuncture, injections, electrodiagnostic testing, that's what I do. And I have 3 wonderful physical therapists that work with me in the office, and they do a lot of the hands-on, getting the patients therapy, getting them to do exercises, etc.
What was the decision to go to learn acupuncture?
Okay. When I was in medical school, I actually was chosen to go as one of 7 medical students to go to China to have a student exchange program. So when I was there, I was exposed to acupuncture and a lot of other types of Chinese traditional medicine. So once I started my practice, a couple of years later, I ran into one of my colleagues. I was working at the hospital. I had to practice part-time. And she told me she was going to acupuncture class. And I said, oh, I'll come too, because I was always interested in a holistic approach to healing. And that's how I started with the acupuncture. And it's been quite some time now.
Before we go to a break, and we'll take a break in a short minute or so, how does anyone find you? If someone wants some of these amazing treatments, how do they find you?
They can find me by going on the web, and we're at www.brooklynsportsrehab.com, and our phone number is 718-852-6949. You could also look up Dr. DeCosta, sports medicine, acupuncture, Yelp, Doc. Okay, so I think that's how people can find me.
Let's take a break.
Okay.